Hi, my name is Dr. Alex Haynes, and today we're going to be discussing erectile dysfunction and men's sexual health in general.
What can be done to reduce the effects of erectile dysfunction?
So I think the most important thing is understanding what is the underlying cause of your erectile dysfunction. First and foremost, if it is something that you're worried about, you should go speak to your GP to get like a thorough health check and make sure there's no chronic underlying disease that could be causing it. So going to the GP, they often do like a panel of blood work. If you're having erectile dysfunction or older age, things to look out for is obviously like a raised sugar, which can lead to diabetes. Often erectile dysfunction is one of the I wouldn't say presenting causes, but one of the first symptoms that patients with diabetes complain about. They often don't experience the other problems until later on, but often a patient will come into the general practitioner with complaints of difficulty to achieve erection and difficulty to sustain an erection, and do a panel of blood tests, and they'll notice that the sugar is actually very high. So first and foremost, I think you have to understand what the cause is. So go to your GP firstly if it is a problem that you're worried about. Get a thorough check. Things that they generally will look for are like they would do a panel of blood tests to see where the cause could be. One, it could be hypothyroidism, so a decreased thyroid level. Two, he might notice a high blood pressure, and leading him to suspect that you might be having hypertension, which you need treated properly. Secondly, you could be having the diabetes mellitus, type 1 or type 2, that you need to be addressing properly. Now, if you've had those underlying causes checked out, things that you can do are often in the range of lifestyle changes. So one, exercise is so important. We spoke previously about the importance of your blood flow and your blood system in achieving and maintaining erection. And exercise directly increases your blood flow, not just to your penis, but to all the different systems in your body. So if you're achieving like good cardiovascular outputs, if your body is in a good physical state, that will naturally lead to like a better and more sustainable erection. On the other hand though, on the other extreme, often hectically endurance athletes that train long hours, that do these ultra marathons, they will also experience erectile dysfunction from overtraining. So what happens is your body, if you're training too hard and too long, your stress hormone, your cortisol level is drastically increased, and what that does is literally directly decreases your testosterone level. So sometimes you will have like a perfectly healthy 26-year-old male, tan, fit, running all these marathons, but coming in complaints of erectile dysfunction just from the fact of overtraining and putting his body through too much stress. But that being said, exercise is one of the most important things you can do. Another thing that you can do is reducing your stress levels. Now that's often easier said than done. How does one get less stressed? So I think there's a multifactorial approach to stress. I like speaking about something called BDNF. So what BDNF is, it stands for brain-derived neurotrophic factor. Starting with the backstory, it was long thought that your brain can't grow new neurons. I'm sure you guys have heard if you have dead cells in the brain, it can't grow back. Yeah. So it's only in the 21st century that they actually discovered that your brain can grow new neurons. But it's only in regions of the hippocampus specifically that your brain grows. And what the hippocampus is, it's an area in the center of your brain that's responsible for your attention span, your mood, and memory. But also as science progressed throughout the years, they noticed that the hippocampus is also responsible for symptoms of anxiety and depression. And it's directly correlated to how much brain cell growth you have in that area of the brain. Now the question is, how do I increase my BDNF, my brain-derived neurotrophic factor? And it's actually simple things. So things like sleep directly increase BDNF, simple things. Exercise directly stimulates a protein which upregulates BDNF. So if you were to put it into three categories, let's say foods that you can eat, lifestyle changes, and educational wise. Let's talk about the foods that you can eat. So saturated fats, bad. Unsaturated healthy fats, such as omega-3s, good fish oils, directly increase BDNF. Also, some red wines have flavonoids in them, which also increase BDNF. So there's a whole list of foods online that you can look up, link in bio, that you can achieve BDNF with. Blueberries. So blueberries are powerful antioxidants. So antioxidants literally means that like it helps fight radical cells in the body that can cause cancer. Things that cause cancer are like the UV rays from the sun that can like directly damage your cell. That's why people get skin cancer, melanoma. So blueberries, they sit in the sun all day, they get baked in the sun. So they release natural chemicals that actually helps protect them from developing cell damage. And when we ingest them, they actually help the body also prevent all these radical oxides and everything from damaging the cell. In terms of lifestyle changes, exercise, specifically actually weight training. So high intensity interval training where one would train intensely for 3 minutes, pause for a minute, and 3 minutes again for about a half an hour period, directly stimulates BDNF growth. Other things such as meditation as well, by relaxing your body, by putting yourself in like a kind of transient state, relaxing yourself directly increases BDNF. Other things such as increasing your testosterone levels, whether it be naturally or therapeutically with medicines, also directly increases BDNF. I think we said like, what can you do to reduce the effects of erectile dysfunction? I think we like first established it's important to understand what the cause of your erectile dysfunction is, whether it be like a physical problem or an emotional problem, like a psychological problem that you might be going through. Ascertaining what the cause is and trying to address that first and foremost is very important. There are obviously very good supplements on the market that one can use to like increase your performance, and obviously other not over the counter but prescribed drugs such as Viagra and Cialis. But you should first and foremostly get checked out for what the underlying cause can be.